Welcome student. I am Mr. Abhijit Bambre, working as Assistant Professor at Gokhale Education Society's Arts, Commerce and Science College Jawhar. Today we are going to learn what is cardiovascular drugs. Unit 2nd 2.3 Cardiovascular drugs. Let's move. What is cardiovascular drugs? First, we discuss what is cardiovascular system. What is cardiovascular system? They are main transport system in our body. Word cardio is related to heart. Cardiovascular system are transport system of the body. This system has three main components. First one heart, second blood vessels and third one blood itself. Here the heart is the system pump and the blood vessel are like the delivery routes. This system has three main components. Cardiovascular system has three main components. One heart, second blood vessels and third blood itself. Heart are system of pump and the blood vessels are like the delivery routes. Blood contain oxygen and nutrient that is required for the body need, and they carries wastage which need to be removed. It's all about cardiovascular system. Then what is cardiovascular drugs? Cardiovascular systems consist of heart and associated blood vessels. Heart pump the blood into body while blood vessel carry the blood toward different organ of the body. Cardiovascular drugs are used to improve the weak and diseased heart and blood vessel and to bring them at normal state. Cardiovascular drugs are drugs which are used to improve diseased heart and blood vessel and bring them to the normal state. Cardiovascular drugs are two types. They are classified on the basis of physiological function as well as pharmacological action. Next, classification of drugs. Classification of cardiovascular drugs is based on the physiological functions. That is, they are classified into 7 types, which is given in cardiotonic drugs means cardiac glycosider. Second one vasodilator. Third one antihypertensive agent or hypotensive agent. Fourth one anti-hypercholesterolemic drugs. Fifth one sclerosing agent. Sixth antiarrhythmic agent, and last one diuretic. The classification of cardiovascular drugs based on physiological functions. There are 7 types: cardiotonic drugs, vasodilator, anti-hypertensive agent, anti-hypercholesterolemic drugs, sclerosing agent, antiarrhythmic agent and diuretic. Today we are discuss only 3 cardiovascular drugs, that is cardiotonic drugs, second vasodilator, and third antihypertensive agent. Let's discuss one by one. What is cardiotonic drugs? Cardiotonic drugs are the drugs used to increase the efficiency and improve the contraction of the heart muscle, which lead to improve blood flow to all the tissue of the body. Means cardiotonic drugs which are used to increase efficiency and improve the blood flow. These are steroidal glucosides extracted from plant Digitalis purpura and Digitalis lanenta. Digitoxin and digoxin are two of the important cardiac glycosides which are obtained from plant Digitalis purpura and Digitalis lanenta. They are used in the treatment of congestive heart failure. Cardiotonic drugs which are used in the treatment of congestive heart failure. They increase the force and velocity of blood in the contraction phase of the cardiac cycle. There are two types of cycle, एक relaxation phase and one is contraction phase. Cardiotonic drugs are those drugs which are increase force and velocity of blood in the contraction phase. Due to its effectiveness, it is used even it having much more toxicity. Cardiotonic drugs having many side effects, but due to its effectiveness, it is used as cardiotonic drugs. Next, vasodilator. What is vasodilation? What is vasodilator? First, we are discuss what is vasodilation. Vasodilation means a widening of blood vessels. A widening of blood vessels usually near the surface of skin. Widening, vasodilation means widening of blood vessels usually near the surface of skin, leading to increased blood flow. With flushing, vasodilation means widening of blood vessels. What is vasodilators? These drugs are used in the disease related to vascular system. The coronary arteries supply the oxygenated blood to the heart muscles. As we know, coronary arteries are supply the oxygenated blood to the heart muscles. Excessive working of heart result in more production of carbon dioxide due to excessive metabolism in the heart. When excessive working of heart take place, it produces more carbon dioxide due to excessive metabolism in the heart. It ultimately causes more demand of oxygen. When production of during the metabolism, when production of carbon dioxide is increased, ultimately cause of more demand of oxygen. If the coronary arteries are narrow, if the coronary arteries are narrow, which is supply oxygenated blood to the heart muscle, it result into insufficient supply of blood. It means insufficient supply of oxygen. It means demand of oxygen is increased. The lack of oxygen supply causes strain on heart and develop severe pain called as angina. Angina is a type of chest pain. Angina is a type of chest pain caused by reduced blood flow to the heart and is a symptom of coronary artery disease. Angina is a symptom of coronary artery disease. Is a one type of chest pain caused by reduced blood flow or improper blood supply, improper oxygen supply, insufficient supply of blood. Vasodilator. In vasodilator, what is vasodilation? Vasodilation means widening of blood vessels. Then vasodilator are drugs which are used in the narrowing of arteries to treat the angina. Next, hardening or thickening of artery wall is due to deposition of cholesterol in arteries are responsible for narrowing of the arteries. Actual reason of narrowing of arteries is deposition of cholesterol. The disease is called as angina pectoris. The disease narrowing of arteries, the disease is called as angina pectoris. Vasodilator are drugs, they dilate the coronary blood vessels. Vasodilators are those drugs which are dilate the coronary blood vessels. These result in increase of blood flow through arteries and therefore increase in the supply of oxygen to the heart. Vasodilators are also called as anti-anginal agent. These drugs are expected to be fast acting for prolonged time. Vasodilators are drugs which are used to dilate coronary blood vessel or to dilate coronary arteries. It's all about vasodilation or vasodilator drugs. Next, antihypertensive agent, hypotensive. As we know, blood pressure is a function of pumping of blood by heart through blood vessels. Blood pressure is a function of blood by heart through blood vessels. It is pressure exerted by blood in the wall of blood vessels while flowing through them. Blood pressure depends on the function of heart, total blood vessel volume, viscosity of blood, elasticity of arteries, and peripheral vascular resistance to the blood flow. It is expressed in of mercury, means millimeter of mercury, a reading. It's an reading measure in millimeter of mercury. blood pressure depend on function of heart. Actually, blood pressure is depend on function of hearts, that is total blood volume. It's also blood pressure is also depend on viscosity of blood, then elasticity of arteries and peripheral vascular resistance to the blood flow. There are two phases of cardiac cycle, that is diastolic means relaxation phase and systolic means contraction phase. There are two cardiac cycle. One is diastolic mean relaxation and second is systolic mean contraction phase. There are two phases. One is systolic phase and another is contraction phase. Systolic means relaxation while diastolic means relaxation and systolic means contraction phase. Ideal blood pressure is 90 millimeter of mercury while ideal systolic pressure is 120 mm of Hg. Next, when blood pressure is increased beyond this level, means generally diastolic is 90 mm and systolic is 140 mm of Hg, then it is diagnosed as hypertension. When blood pressure is increased beyond the normal level is diastolic is 90 mm of Hg and systolic is 140 mm of Hg, then it is diagnosed as hypertension for particular individual or particular persons. The primary symptom of hypertension are fatigue, means uncomfortness, dizziness, headache, feeling of uncomfort is a symptom of hypertension. Hypertensive drugs are counteract on hypertension by reducing the blood pressure to the normal level and thus removing the associated symptoms and discomfort. Hypertensive drugs or hypotensive are drugs, they are counteract on hypertension. They are reduce blood pressure to the normal blood pressure level for they removing associated symptom like fatigue, dizziness, headache, feeling of uncomfort, etc. Thank you. It's all about cardiotonic drugs, vasodilator and hypertensive drugs.